Have you ever wondered why your energy drops, your erections feel weaker, or your legs feel heavier as the day goes on, and everyone tells you it's just aging? Let me ask you a private question most men never say out loud. What if the real issue isn't testosterone or your heart at all, but how well blood is actually flowing through your body? Many men over 50 believe poor circulation is inevitable. Yet there's a simple, overlooked factor that quietly supports blood flow as we age. Today, I'll explain what most doctors never connect. I'm Dr. Olivia Harris, a urologist with 43 years of experience. Tell me where you're watching from, and don't forget to like and subscribe. As men move past 50, one of the quiet changes I see again and again in my patients is a gradual decline in blood flow, even when they think their health is pretty good. Biologically, this happens because blood vessels naturally lose some of their elasticity with age. The inner lining of your arteries, called the endothelium, becomes less responsive, meaning it doesn't relax as easily when your body needs more blood. That affects how oxygen and nutrients reach your muscles, your brain, and very importantly, your sexual organs. This isn't about weakness or failure. It's a normal process, but it's not something you're powerless against. Emotionally, this is often where frustration starts. Men tell me they wake up tired, they run out of energy faster, or they notice erections aren't as reliable as they used to be. Many assume this is just testosterone dropping, or that this is what 60 feels like. But poor circulation is often the missing piece. When blood flow slows, everything downstream feels it. Your stamina, your focus, even your mood. Ignoring these early signs doesn't make them go away. It quietly allows the problem to deepen year after year. From a practical standpoint, the first thing I want you to do is pay attention to subtle signals your body gives you. Cold hands or feet, leg heaviness at night, slower recovery after walking, or weaker morning erections are all circulation clues. One simple daily habit I recommend to men over 50 is gentle, consistent movement, nothing extreme. A 10-15-minute walk after meals helps stimulate blood vessel function and improves insulin response, both of which support healthier blood flow. Consistency matters far more than intensity. I also want to reassure you, declining blood flow is not a verdict on your future. It's information. And when you understand what's happening inside your body, you can start making small adjustments that protect your energy, sleep, and sexual health. Because what most men don't realize is this process doesn't suddenly start at 60. It often begins much earlier, quietly, years before the symptoms become impossible to ignore. One of the most overlooked factors affecting circulation in men over 50 is something almost no one talks about: pH balance inside the body. Biologically, your blood needs to stay within a very narrow pH range to deliver oxygen efficiently. As we age, stress, poor sleep, medications, and modern diets can gently push that balance off course. When that happens, red blood cells don't release oxygen as effectively, and blood vessels become more reactive and less relaxed. You don't feel this as pain at first. You feel it as fatigue, heavier legs, slower thinking, and weaker physical response where blood flow matters most. Emotionally, this is confusing for many men. You may be eating better, cutting back on sugar, or taking supplements, yet your energy still isn't what it used to be. I hear men say, "Doc, I'm doing everything right, so why do I still feel off?" This is where pH balance quietly enters the picture. When your internal environment becomes slightly more acidic over time, your body has to work harder just to maintain normal function. That extra effort drains energy and strains circulation, especially in men over 60. Here's something practical you can start paying attention to today. Hydration matters more than you think. Mild dehydration thickens the blood and worsens circulation, especially overnight. Make sure you're drinking water consistently throughout the day, not just at meals. Also, notice how your body feels after heavy processed meals. Many men feel sluggish, not because of calories, but because those foods temporarily worsen blood chemistry and blood flow. Choosing simpler meals more often can make a noticeable difference. I also want to gently challenge a common belief. Many men think circulation problems are only about the heart or testosterone. In reality, chemistry matters just as much as anatomy. Supporting healthy pH balance helps your blood flow more freely and deliver oxygen where it's needed. And once you understand this connection, the role of certain natural compounds starts to make much more sense, especially one your body already uses every single day. Goal. Now, Let's talk about bicarbonate, because this is where many men finally connect the dots. Biologically, bicarbonate is one of your body's main buffering systems. Its job is to help keep your blood from becoming too acidic, so oxygen can be released properly into tissues. As men age, that buffering system becomes less efficient, especially with chronic stress, poor sleep, and reduced kidney efficiency. When bicarbonate levels are low or under constant demand, blood flow suffers because vessels don't relax as easily, and muscles fatigue faster. Emotionally, this explains why some men feel like they run out of gas sooner than they used to. You may start a walk feeling fine, then suddenly your legs feel heavy, or your breathing feels shallow. That's not weakness, it's oxygen delivery. I've had men in their 60s tell me they thought something was seriously wrong with their heart, when in reality, their circulation just wasn't supported at the chemical level. Understanding this can be incredibly reassuring. Practically, the body already produces bicarbonate on its own, but lifestyle matters. One simple step is to support your natural buffering system by reducing constant acid load. That means spacing out heavy meals, prioritizing vegetables, and avoiding late-night overeating, which stresses circulation during sleep. Gentle physical activity also stimulates bicarbonate regulation by improving how your muscles use oxygen. Even light resistance exercises a few times a week can help men over 50 feel steadier and more energized. I want to be clear and responsible here. I'm not talking about extreme remedies or self-medicating. I'm talking about understanding how your body maintains balance and how everyday choices either support or strain that system. When bicarbonate support improves, many men notice better endurance, warmer hands and feet, and more reliable sexual response. And what's fascinating is how closely this ties into testosterone, sleep quality, and nighttime blood flow, which is exactly what we need to talk about next. One of the biggest misconceptions I hear from men over 50 is that testosterone alone controls energy, desire, and performance. Biologically, testosterone does matter, but it doesn't work in isolation. Hormones rely on healthy blood flow to reach tissues and do their job. If circulation is compromised, even normal testosterone levels may not translate into vitality. Blood vessels need to be flexible and responsive for hormones to signal properly, especially in muscles and sexual organs. Emotionally, this is where disappointment often sets in. Men come to me frustrated because blood tests look fine, yet they still feel sluggish, unfocused, or disconnected from their bodies. Some have tried boosting testosterone only to feel minimal change. That's because hormones are messengers, not the delivery system. Without proper circulation, those messages don't arrive clearly. This can feel discouraging, but it's also empowering once you understand what's really happening. From a practical standpoint, supporting circulation naturally enhances how testosterone works. Prioritizing sleep is one of the most overlooked factors. During deep sleep, testosterone is released and blood vessels recover from daily stress. Men over 60 who sleep poorly often experience both hormonal and circulation decline. I recommend creating a consistent window routine and avoiding heavy meals late at night, which divert blood flow away from recovery. Light evening stretching can also improve nighttime circulation and sleep quality. I also want to address performance anxiety because stress directly tightens blood vessels and blunts testosterone. Signaling, learning to slow your breathing, especially before bed, helps activate relaxation pathways that support blood flow. Simple techniques done consistently often bring noticeable improvements within weeks. The goal isn't perfection. It's creating conditions where your body can work with you instead of against you. When testosterone and circulation are supported together, men often report better morning energy, improved confidence, and more reliable sexual function. And here's something many don't expect. Even if you do everything right during the day, poor sleep and chronic stress at night can quietly undo your progress. That's why what happens while you're asleep matters more than most men realize. By the time night arrives, many men over 60 assume their body is finally resting. But biologically, nighttime is when circulation either recovers or quietly deteriorates. During healthy sleep, blood vessels relax, inflammation decreases, and tissues receive steady oxygen for repair. When sleep is fragmented or shallow, stress hormones remain elevated, keeping vessels slightly constricted. Over time, this nightly strain reduces blood flow efficiency and leaves you waking up already depleted. Emotionally, this creates a frustrating cycle. You go to bed tired, you wake up tired, and you start to believe your energy is permanently gone. Men often tell me they feel most drained in the morning, not the evening. That's a major clue that nighttime blood flow isn't being supported. Add chronic stress and the problem compounds. Stress keeps your nervous system on alert, narrowing blood vessels and interfering with the deep sleep stages where circulation restoration should occur. Practically, there are small changes that make a meaningful difference. One of the most effective is controlling evening stimulation. Bright screens, late news, and intense conversations all trigger stress responses that linger into sleep. I encourage men over 50 to create a simple buffer period before bed, even just 20 minutes of dim lighting and calm breathing. This allows blood vessels to begin relaxing before you lie down. Another helpful habit is keeping your bedroom slightly cool, which naturally supports healthier circulation during sleep. I also want you to pay attention to your morning routine. Rushing out of bed, skipping hydration, or consuming caffeine immediately can shock your circulation system. A glass of water and gentle movement before coffee helps blood flow re-engage smoothly. These aren't dramatic changes, but consistency is powerful. When sleep and stress are addressed together, men often notice improved energy, warmer extremities, and steadier mood within weeks. But even with better sleep, many still struggle because daily habits during waking hours quietly sabotage circulation, which brings us to what you can safely and realistically do next. At this point, many men ask me the same question. What can I realistically do to support circulation without turning my life upside down? Biologically, your blood vessels respond best to steady, predictable signals. They thrive on regular movement, balanced chemistry, and reduced stress, not extreme programs. After 60, the goal is not to push harder, but to support what your body already knows how to do. Emotionally, this is where relief often sets in. You don't need complicated supplements or punishing routines. Small doctor-approved habits done consistently matter far more. I encourage men over 50 to think in terms of daily circulation support. That means moving your body every day, even briefly. Short walks, light stretching, or simple resistance movements help keep blood vessels responsive. Skipping movement for days at a time is far more damaging than most men realize. Practically, hydration remains foundational. Blood that's blood. Slightly thicker from dehydration strains circulation and the heart. Sip water throughout the day, especially in the morning and early afternoon. Pair that with balanced meals that don't overwhelm your system. Heavy late meals divert blood flow away from repair and sleep, while lighter dinners support nighttime recovery. Breathing also plays a role. Slow, deep breaths activate relaxation pathways that widen blood vessels and improve oxygen delivery. I also want to stress safety. Avoid chasing quick fixes or internet trends promising instant results. Supporting circulation is about patience and rhythm. Many men notice improvements in energy, sleep, and sexual confidence within weeks when they stay consistent. These changes may feel subtle at first, but they compound in powerful ways. The most important message I want you to hear is this: aging does not mean decline is inevitable. When you support circulation properly, you support testosterone function, sleep quality, and overall vitality together. And once you experience how these systems work in harmony, you begin to realize your best years aren't behind you. They're being built by what you do next. In this closing, I reassure you that slowing down is not a personal failure. It's a signal your body needs support, not surrender. I remind you that small, informed choices can restore energy, confidence, and control, even for men over 60. I reinforce that circulation, sleep, and daily habits work together, and that it's never too late to improve how you feel. I invite viewers to comment, share their experiences, and join a community of men taking charge of their health. I close with encouragement, reinforcing the message: your best years aren't behind you.